Greetings. Welcome to Epidemiology 901. This is a map of the course, and I just want to give an overview. We will come back to this various times to sort of find our way and see where we are, starting at the 30,000 foot level back to the 30-foot level. I call this the epidemiology process flowchart, and it starts with a sort of circular process of planning, detection, response, evaluation, refine activities going back into planning. And so the specifics in that include the fact that there are core epidemiology and public health functions and services that are in place, and those services or ad hoc notification by others may detect or let us know about problems that exist. We might check into surveillance systems, that sort of thing. And with the notification of a problem, we then make a choice to wait or respond. At the point that we respond, we may immediately do something to institute control measures, either at the individual or population level, or we may want to do further investigation. And at the beginning of investigation, we'll do descriptive epidemiology, and that will look at who, what, where, when, or person, place, and time, similar to how journalists do it. And we will begin active case finding, interviewing for other people that were affected or exposed, making case definitions, collecting specimens, and using our surveillance and other sorts of information systems to better characterize the problem and its distribution. Through analysis and summarization, we may decide that further study is needed, at which point we'll begin the analytic epidemiology, formulating a hypothesis and studying through different means and methods to determine what are the causes, are the things that are being done the right things, and are we doing them correctly. Again, that may involve more data collection, using tools, and specimen collection. We will also, in the response, then go back to the treatment of patients or screening and control of population level things. We'll define indicators to monitor whether our interventions are successful, and our control measures. And then there is a very important step of communication and coordination with other agencies and people to be sure that we're on track. And then the evaluation. So, for example, in week 5, we'll be beginning outbreak investigation. In week 2, 3, we'll be doing descriptive epidemiology. In week 12, surveillance systems. And in week 13, evaluation and the community guides, clinical services guides. And so as we go through the course, we will come back and look at where are we in this and what other things are circling back and forth to help us figure out sort of many of the things that we do in epidemiology, such as making 2x2 tables, measures of association. The statistics will be relevant whether we are in descriptive epidemiology, different kinds of analytic epidemiology, using surveillance systems, and it will help us to sort of see all the places that we are using the skills that we have going. So we'll come back to this. There's a similar process that we hear about in this course called the epidemiologic or public health process. And as we had the steps of planning, detection, responding, and evaluation, the public health process, which was made very famous by gun control, tobacco, and other sorts of things, and we will use in each steps in epidemiology include detecting and defining the problem, characterizing who is involved, the who, what, where, when, identifying the influencing factors and what's associated with it, whether there are socioeconomic factors, geographic factors, time, that sort of thing. Developing and testing evidence-based interventions at the individual and the community level, implementing the intervention and monitoring the intervention's effectiveness and delivery methods. And this cyclical process is important to the conduct of epidemiology and public health, and we'll see many times how it plays out in different cases. Thanks.